Hello and welcome to the 2026 Empowered to Serve Business Accelerator information session, specifically for the Health Tech Enabled Products and Services track.
Hi, everyone. So for today, this will be our agenda. We'll start off with introductions of the program staff and folks that you can look forward to connecting with and hearing from today. We'll also do a program overview, and then at the end, we'll answer any questions you may have.
And hi, I'm Michelle Raphael, and I am the Business Accelerator lead for the American Heart Association. I have been with the program since its inception, since 2017, and will be your main contact at the AHA during the entire process and after the accelerator as well, if you become an accelerator alumni. Arka Kaysen is also my co-lead, and she is the National Senior Program Lead for the American Heart Association. And then Krista, I'm not sure if you're still having technical difficulties or if you can come on.
I think she may still be joining.
Okay. And then Krista Chambers Price, which hopefully will be on in just a few moments, will be your lead facilitator for the Empowered to Serve Business Accelerator training portion.
And then my name is Olivia Phillips, and I'm with Matter. For those of you who are not familiar, Matter is a healthcare technology accelerator and incubator, and we partner with organizations like the American Heart Association to do programs such as the one you'll learn from today.
So, what is the Business Accelerator? The Accelerator is designed for founders who are building health focused businesses and navigating complex systems where progress depends on real adoption. We started this program in 2017, and this is an opportunity for you to gain training and also for you to gain the ability to have grant opportunities. And so since 2017, we have given away over $1.47 million in grant funding. We've trained over 181 social entrepreneurs. And from those that have gone through the accelerator, their companies have gone on to raise over $323 million. And we've had one acquisition and one closing acquisition since the inception of the accelerator.
So for today, as shared, we're talking about the Health Tech Enabled Products and Services track. This program offers two tracks. We do have a session that we have recorded on the collegiate track. So for those of you who are interested in that, we will be sharing that out. But today we'll focus on this track. As just a little bit of an overview, so this track is designed for early stage and growth stage startups that are really ready to build real momentum for your organization. It supports founders, both nonprofit and for profit, who are building tech enabled health solutions designed for those who either have a prototype, pilot, or early traction, and then also focuses on strengthening those adoption and navigating health system pathways. And so we'll talk a little bit more about what that looks like here in a moment. But again, this is just kind of a high level overview of what this track is designed for and who it's looking to serve. In terms of benefits of participation, so you will receive a participation stipend. Also, for first place, you have the chance to earn $100,000 in non-diluted funding, and then $50,000 for second place non-dilutive funding. You'll also build and expand upon your entrepreneurial and problem solving skills. You'll be able to validate your ideas through structured feedback, and we'll dive kind of into the curriculum and what that looks like in a moment. You'll learn lean startup principles and also storytelling, which is really important to convey the impact of the solution that you've built. You'll also be joining an innovative and supportive cohort of entrepreneurs. And then lastly, one participant from each track. So that'll be this track, the Health Tech Enabled Products and Services track, and also the Collegiate track will have the opportunity to participate in rapid validation labs where you will really get to pressure test your solution in a real world setting.
Okay, so let's talk about what to expect. So, the American Heart Association's Business Accelerator is designed to help you do more than just build a strong idea. It's built to help you understand whether the systems around your idea are actually ready to adopt it. So now, while most accelerators focus on developing your solution and preparing you to pitch, this experience focuses on what happens after you pitch, where real decisions are being made. So, as a candidate, you'll move through a structured experience that combines system insight, hands-on building, and real-world preparation. And you're going to learn how to map how decisions move through systems. And when we talk about systems, we're talking about organizations, hospital systems, those types of structures. You're going to use tools like the Adoption Logic Map and Narrative Performance Index to learn how budget, risk, workflow, and authority shape whether an idea moves forward or stalls. You're going to participate in a 5-day design sprint where you'll rapidly develop and test your idea through a focused sprint, clarifying your purpose, understanding your environment, and building a simple model, testing signals within your ecosystem, making key decisions about so you can make key decisions on how to move forward. And then you're going to also strengthen how you communicate your idea. So through narrative performance and narrative intelligence, you'll refine how you explain your work to build trust and align it with how institutions make decisions. You're also going to test how your solution fits into real world systems. So you'll explore how your idea would actually be implemented, not just understood, including completing and being adopted into operational, financial, and stakeholder realities. And finally, you're going to prepare for real world conversations. By the end of this program, you'll be ready to engage with partners, organizations, and decision makers with clarity and confidence. So, just to reiterate, this accelerator is not about perfecting a pitch. It's about preparing you to move your idea forward in the real world.
So, as mentioned before, you have the ability to earn grant funding. There's going to be two tracks. One is the health tech enabled products and services, and the other is the collegiate track. And there will be a first and second place from each track. First will get 100,000, second will get 50,000. Um, the grant funding must go towards health impact. So that means that it will not go to things like office equipment or one-off events or a new coffee maker or just a branding awareness type campaign. It actually has to show a health impact towards what you are putting the grant towards, and you will work with us to develop those goals that you want to reach and also to create a budget around the grant funding. The other opportunity that you will receive as a first place finalist is that you will be invited to the 2026 scientific sessions, which will be following our October event. It will happen November 6th through 9th in Chicago. So we will help you with the travel to Chicago, as well as provide you with complimentary entry into the session.
So now we'll talk a little bit about who can apply. So of course, applicants must be 18 years or older. Applicants should be the founder or CEO of the nonprofit or pre-seed, seed, or Series A startup. I also will say that we also know that some may work in teams. And so if you are applying as a team, again, you should at least be a part of the team in some capacity, and we'll kind of work with you on that. Also, companies must be based in the US, and your innovation should have a positive impact on equitable health in the US. And so, thinking about addressing those social drivers of health, you want to make sure your innovation is kind of having a positive impact and improving health outcomes.
So part of the evaluation criteria, we will be looking at your application. So the AHA and Matter will be reviewing for organizational fit. We will also be looking at whether the training and the funding amount will align with your business. So, do we think that you will benefit from the training? Do we think the funding is too little for your business to be scalable? Or do we think you've already raised too much funding? So we'll be looking at both of those elements. And then one of the most unique parts about the accelerator is that the top applicants, your application will actually be shared with the AHA Science and Health Metrics team, and you will receive a score and evaluation from them around health impact potential, innovation and viability, and also scalability of your company. And you'll get to see and receive that evaluation.
So now we'll talk a little bit about the timeline. So currently applications are open, and we'll share the link to where you can find that as well on the web page. Applications do close April 27th. Oh, I think I am freezing a little bit here. Okay. So applications are open and they close April 27th. Applicants will be notified the week of June 15th. The accelerator training will take place from June 22nd to August 14th, so it'll be about 8 weeks. And then following that, the select candidate from each track will participate in the rapid validation labs. You'll then do some final showcase preparation where we'll work with you on refining your presentation and making sure you are prepared for the final showcase that'll happen at Matter in Chicago in October.
We wanted to just share a couple of insights from our past accelerator candidates and what they've been able to achieve. Once you go through the accelerator and you become an alumni, you will be a part of the AHA entrepreneurial ecosystem. We'll present you with different opportunities to be a part of either events or be able to be a speaker. Not every, it's just going to depend on what your business is and what the opportunities are that come up, but we love to get you involved as much as possible. We will also be using a platform to help you gather metrics on your company moving forward and how you're doing, and also help you figure out the industry standard metrics for your specific SDOH category and how to gather that data. And here are just a few. So Pure Sweet, Colby Takeda, he went through our program, and he has had wide success following being in our Hawaii-based accelerator. And he actually moved on to be a part of the Social Impact Fund within the American Heart Association, which is another entrepreneurial opportunity where you can receive direct investment and funding for your business. And so once you go through the accelerator, you have more of an ability to be recognized by the Social Impact Fund, or at least reviewed by them. And then Leo Lizarondo from 412 Food Rescue actually was asked by Nancy Brown, our CEO, to co-lead in a presentation about food security. So those are just two examples of amazing things that can happen being a part of the accelerator, but there are a lot more examples, but just wanted to give you that little snippet.
So now we'll just do a recap before we kind of dive into your questions. Again, this track is really designed for those early stage and growth stage startups. Applications do close April 27th. You'll be notified the week of June 15th. And then we have a QR code here for you to scan and visit the site to learn more and access the application. If you have any questions or concerns, please feel free to reach out to us at nextgen@heart.org. And also, this session is being recorded, so we will share it out so you can access the slides as well for your own reference and review. And I think now we will go ahead and kind of step through your questions. So I'll read them off. As questions come up, please drop them in the Q&A, and then we'll go ahead and read them live to answer them. And so the first question we have here, Michelle, is how big is the cohort?
That's a great question. So we don't really like to put a number. It's really going to be based off the quality of the applications on how many will accept. In the past, we have accepted 10 to 12 applications or 8 to 12 applications, but this is the first year that we're doing 2 tracks, so we don't like to put a number. But one of the great things about the training process is that we will have a pre-accelerator training week. And so if you are accepted, you will have that first week to find out more about the program, realize the time commitment, and see if that is really something that you are able to handle as far as timing and being able to achieve all of the set deliverables for the accelerator.
Thank you. The next question we have here is how competitive are the grants and the Rapid Innovation Lab opportunities?
Yeah, so the Rapid Validation Lab, we will be accepting 1 candidate from the health tech enabled products and services and 1 from the collegiate track. So it is going to be very competitive since only 1 out of all of each of the groups will be accepted. And it will really be based off of some basic questions that we ask during the pre-accelerator process to get information around your company and whether we feel like it will be beneficial to have you in the program, and also what partnerships we have available to pair you up with.
Thank you. The next question we have, can you please describe examples of it going towards real world health impact?
Sure. So your funding could go towards, we think of an example. So people have talked about FDA approval, sometimes like having to pay to test the model. Also, like if it's a community-based solution, if you need to have staff on site for making sure that you can test your or use your product or use use your product in these different events that you're having, making sure that you have patients to validate your model. So it really just depends on where you are with the health tech. So building out your app, it depends on whether you're in the beginning stages of your company or you're actually already progressing into it. But you just really need to show that what you are using the funding for is actually reaching your patient or your audience, and it's not something one-off where you're just, you know, paying your staff or um, paying to upgrade your computer systems, right? Like we know that all of these things are essential to your business, but we want to be able to show the direct connection to making your direct consumer have a healthier life. So it's kind of hard to give an example because it just depends on what your business is really focused on. But those are definitely questions we can help you once you are in the program.
Absolutely. We did have another question. What is the timeline once again for the entire program? So I'll go ahead and flash that up while we're
Yeah.
answering additional questions. But again, applications are currently open. They open March 3rd. They close April 27th. You'll then be notified the week of June 15th. The accelerator training is approximately 8 weeks, so it'll go from June to August. You'll then, for those who are selected or from the candidate that's selected from each track for the rapid validation labs, following the accelerator training, that will begin. And then we'll do final showcase preparation in October, leading up to the final showcase at Matter in Chicago. Next question we have. So, is the accelerator focused on specific health conditions or is it open to all areas within healthcare? And then I'll also bundle that because we did have another question that asked, does it need to specifically focus on heart health or can it focus on heart health?
Great question. We do not have a specific focus on a condition. You can focus it on heart health, but it's not necessary. We It needs to address the social determinant of health. And then we do have a specific focus on women's health and nutrition security, but that doesn't mean you have to have that as part of your application. But we would like to have an emphasis on that area, but you can focus on any type of condition as long as you are emphasizing that it is addressing a social determinant of health, which is a barrier for someone to be able to reach optimal health.
Thank you. The next question we have regarding the 8 week program, how much time commitment does that require for our company? I think, Krista, if you can come off of camera and mute, this may be a great question to toss to you.
Of course, that's a great question. Now, the timing really is determined by your schedule. We really try to move all the content and the training to work around you because we know that you're running your business at the same time you're involved with the programming. We do recommend that you dedicate at least 4 to 6 hours a week in the beginning, because we are going to be going through and really diving deep on some of these areas that are a little difficult to just kind of build a fast response to. We're going to go deep on exploring every aspect of your business model and your differentiator. And so 4 to 6 hours a week is recommended in the beginning. If you can, it's not a mandate at all, but certainly 15 minutes is not going to do either. Towards the end of the program, you may find yourself needing more time, but that's up to you and how you want to manage it with your schedule. And we try and be extremely flexible with working around what you need in order to complete the program.
Thank you so much. This is also a really great question. If you aren't based in the US, but building your product for the US, can you set up a company in the US to apply?
So we have had applications from organizations that are based. We've had a few that were based in Europe, but had an actual office in the US and had a focus on US patients. So you would at least need to have an office in the US to show that you're based here, you're able to operate from here, and that you're having impact on the US population.
Thank you. And I'm sorry, y'all. I'm trying to like type in and read your questions as we go. So please bear with us. Another question that we have. So, Krista, this may be for you. Does the training require full-time participation? This person is kind of a solopreneur. So they're wondering what participation looks like.
It definitely is not full time at all. It should not be. Because we again, we recognize that you're running a business, or for some folks, they're in grad school or they're in medical school. And so we really want you to feel empowered and have the agency to work this program into your existing schedule. And the pre-accelerator work that Michelle mentioned earlier will give you a highlight on how to approach organizing your time, because then you'll get to see the entire curriculum and gauge for yourself based on what you currently have on your table, how you can adjust your schedule to make all of it work.
Great. Someone also asked, is anyone within Matter going to essentially participate in selecting the applications? And the answer to that is yes. So we'll work collaboratively to review applications. And again, we shared some of kind of the criteria in that. So we'll be making sure that we work through that together. So let me mark that one. And then the next question we have, can we apply for both cohorts if we are completing our doctorate program and are a tech startup founder?
Yeah, so the application is actually the same for both. You'll just have one part of the application, I believe it's towards the beginning, where you mark if you are health tech enabled products or services track or if you're collegiate. So what I would say is just choose the one that you think works best for you. And if you're in a startup phase and you're in that collegiate track, I would stick to the collegiate track, because what is really going to be the differentiator is the training. So the health tech enabled products services training will be at a higher level than the collegiate, because most of the collegiate will be in more of like that startup phase, or building on an idea, or a a model that they're working on. And the health tech track will usually be a little further along and have some sort of prototype and a business model, or even already be in business, have some sort of um, capital raise. So we know that they'll need to be in a different sort of training, because they'll be needing a little bit higher level of looking at their business and what they're missing or how they can be better. So I would say just choose what you think is best, but we will also, when we're reviewing your application, we can make a decision that, you will be accepted, but we think you'll be a better fit maybe in another track.
Thank you for that. The next question I see asked, does the program take any equity or IP? The answer to that is no. We will not, we don't take equity or anything like that for this program. So let me go ahead and mark that one. The next question we have here, it looks like, so if our company is focused on a direct to patient model, is it still eligible to apply?
Yes, for sure. It is.
Great. We also have a question. Let's see, Krista, I wanted to bring this one to you. Regarding the 8-week program for accelerator training, what does that look like? Are there weekly meetings? Again, this one is just wanting to dive a little bit deeper into the time commitment.
Yeah, we generally have group weekly meetings or bi-weekly meetings so that both cohorts can meet each other and network. For the individual candidates, I do encourage um, um, each of you to schedule office hours. So office hours typically are like your typical stand-up meeting, which is about 30 minutes. And we cover the curriculum for that year or for that week rather, and I can answer your questions directly. We do have a platform that you'll be working from so that let's say you have a question that's in the middle of the night and it's after business hours. I still get pinged and notified when you post that question so that you can get an answer as soon as possible. So we try and do a blend of technology to group meetings to individual office hours to give you the support that you need.
Yes, so thank you for that. The next question we have, so if a participant doesn't get first or second place, is there any funding available and what would the stipend look like?
Yep. So all participating individuals will receive a stipend if they do not receive a grant. And we'll review that once you get into the accelerator, what that looks like. And then there is also a fan favorite. So people we'll give more information on that once we get closer to the event, but there will also be a grant for um, fan favorite voting on the top candidate.
Thank you so much. The next question we have, are mental/behavioral health tech startups eligible to apply?
Yes, they are.
Great. And then this looks like it may have been a part of another question. So looking for that. Uh, Another question we have is, what is the general acceptance rate for this program?
Yeah, I think we went over that before that we don't really look at quantity, but we really look at quality as far as what we accept into the applications.
Absolutely. The next question. So, we have a platform that crosses disease conditions. Given that cardiac patients also frequently have respiratory problems, dementia, etc., should I concentrate on cardiac patient benefits or emphasize the whole person aspect of our digital health solution? So, I think that one is pertaining to the application, how they should frame it, if
Yeah,
we have
Krista,
any
you want to take that one?
Um, yeah, that's a good question, actually. Olivia, can you read the two choices again?
Yeah, so they asked should they concentrate more specifically on cardiac patient benefits, and I'm assuming obviously because of the AHA positioning, or emphasize the whole person aspect of their digital health solution.
Definitely the whole person for sure. Yeah, because it's not just about having a positive or a directed patient outcome. The AHA is also looking at scalable models too. And what the second option, Olivia, that you read, that presents a bigger picture, which allows us to see which is absolutely possible. But then with the client focused portion of that model, then we can zero in if needed within the accelerator to see how we can strengthen that even further. So definitely lead with the larger model for sure.
Absolutely. The next question that we have, what makes a successful submission video? So I can take this one. We already have, we'll have the application, and in that you'll share more about your solution, your why, and kind of the health impact. In the video, what would really be helpful is to learn a little bit more in depth about you and also what you may not have been able to convey on the actual application. So again, highlighting things that you may not have discussed or been able to go in depth about in that video, will really help us to just review your application in a more holistic manner and learn more about you. Let's see, next question. So um, Okay, someone asked if we could go over, I think they're asking more about the selection or the review criteria. Or the evaluation criteria. Michelle, do you want to step through this just a little bit one more time?
Yeah, I think reading through that question, they wanted to understand more of
About,
what an organizational fit means.
are we
And yeah,
okay?
so for us, that's really focused on whether we feel like you're following the AHA guidelines. So let's say you are focused on CPR. So we would look at whether you follow the guidelines in terms of your CPR focus. Or one of the biggest challenges for us is the food angle. So if it's a product, do you fall within the guidelines of the AHA? One of the things we didn't really talk about here was, some of the types of companies that we would not accept, and a lot of those are focused in the food area. So we get a lot of, smoothie bars and health focused products, um, gyms, private practices. So those would not be a good organizational fit for us. So hopefully that clarifies that a little bit more for you.
Thank you. And I think you may have also touched upon this other question about the evaluation criteria. So I'll move on to the next one. Is the accelerator open to preclinical deep tech hardware, biosensor startups, or is the cohort primarily digital health and care delivery? And do we have kind of a target readiness level range, or what TRL range have past cohorts typically been at? And maybe Krista, this may be a question for you.
Yeah, that's a great question, and we're happy to say that this year we can and we are accepting medical device based applications. So we're finalizing some relationships with a group that is really deep in that commercialization lane, and I'm really excited about that because before we were just kind of focused just on the device itself, but absolutely, please apply because we're ready for you.
Thank you so much. The next question we have, so this person offers a B2B solution that helps community care orgs better understand and serve diverse populations. They don't necessarily serve consumers directly. So the question is, are we open to such solutions? And if so, how would they like to see, how would you like, basically, how would they demonstrate outcomes in that?
Krista, do you want to take that one?
Sure. So this one is a little tough because the outcomes are not exactly, I wouldn't say immediacy is not at the core of this answer, but it's like one of the things we talked about earlier. I think Michelle, you mentioned that consultancies are not really a good fit for the accelerator, and we would have to look at your application very carefully to see is it just are we talking about a consultancy model, or is that consultancy model actually helping to improve the organizations do what they're doing better in the community? And it's such a fine line. I hate to say no, don't apply, but if it falls into that consultancy lane, it's gonna and we can't really see the differentiator that's gonna pull you out to show how you can really demonstrate and articulate that impact, that end to community impact has to be clear. And if it's not, then it's going to be difficult to approve it, to move forward.
Thank you. The next question we have is what post accelerator opportunities exist for those companies that aren't selected for the rapid validation lab? So I think we covered this a bit on this slide, but again, you'll be a part of an entrepreneurial ecosystem from both organizations. And also the engagement opportunities are varied. So it may be dependent on what may come up at Matter, what may come up at AHA, but we really do like to continue to have companies engaged and participate in additional programmings to continue to help you grow and scale and refine. I think so. We answered this a bit. What have successful alumni companies done best to leverage the program? I think, and I'll start this, and then Krista, maybe you want to hop in. But in terms of kind of if you were selected to participate in best leveraging, is really showing up and participating immensely, taking advantage of the opportunity, participating in kind of the weekly sessions and the online activities that we'll have to then be able to kind of continue to help you grow and refine your solution. I'll also share again, reiterating what Michelle shared is that there's different opportunities that may come up. And so as we think about your participation in this cohort, we can, also think about the opportunities that come up to be able to maybe put you in front of, just different other opportunities for you to take advantage of. And so that is a very, I know, generic answer, but it part of it is dependent on, of course, what comes up, but the other part, we really emphasize you participating in the sessions that we have for the curriculum. And Krista, I'll toss it to you as well.
Yeah, just to add to that, there are what, 7 regions, Michelle, that the American Heart Association exists in. And one of the things we also try and emphasize is to connect you to the local AHA offices. So that means you have a group that's on the ground that is just as, committed to your success as you are. So participating in the accelerator is not just about getting the grants, which is amazing. Yes, awesome. But you're going to be a part of a 600,000 plus network of scientists and professionals and investors, and they're all looking at you too. So it's just a fantastic platform to be positioned, to be visible in front of this entire network from the macro to the micro.
Thank you. Krista, I may also toss this to you. Can you provide examples of what early stage may look like, and if there's a specific type of prototype we may be looking for? And also the last part of that is, what about relationships with institutions? Do those count as early signs of market fit?
Great question. So let's start with early stage, what we mean there. So with early stage companies, we're looking at folks who have at least applied for or tried to raise, excuse me, a pre-seed or a seed round. Um, Early stage for us is not those who are in ideation mode. So you're still trying to figure out what the business is or what you want to do. You should have a pretty solid foundation around and also proof that the model that you want to implement has has potential, right? So the prototypes themselves, they don't have to be perfected through the design sprint that you're going to go through. We're going to probably use that existing prototype and either make it better or learn from it or see where there's opportunities to grow. As far as working with institutions, it depends on where you started in terms of introducing that concept or that idea from that institution. Like we've had professors who have created something that's completely new, and they've negotiated early that they own the IP and not the institution. Where we've had other folks where they came in and the institution themselves own the IP from top to bottom. And so that means that early stage is early stage, but it's with a caveat to what the institution will allow to grow or what we're even allowed to even talk about publicly. So we have to look at it from a case by case perspective, but we can say our bottom line is you do have to have a business model that has had some traction You don't have to be 400 miles down the street, but you certainly are not at the, so should we do it this way or that way? That part should be done before you apply.
Thank you so much. We just have a handful of additional questions before we close out. One other question we have is home care or in-home health delivery a focus area, or would that need to be framed around a specific social determinant of health to be a strong fit?
So we don't have a specific home health delivery category per se or focus area, but that doesn't mean that you would not be accepted into the program if you apply with that. But we do want to see a social determinant of health category being pulled out in your application. So I'm, I'm going to go out and assume that something with home health care would be addressing access to care. Um, Maybe it's not, but that could be a social determinant of health category that you choose to go along with it. So, short answer, I would say still apply because as long as you are addressing a social determinant of health within that home health category, you could be a good fit.
And Michelle, can I add to that real quick?
Yeah.
When you have a model like that, just think about the fact that you're in a highly saturated market. And what would make your application really interesting for us as we're reviewing it is your ability to articulate that you recognize how saturated the market is, but how your model differentiates. Okay, that's what would make your application compelling.
Thank you so much. I want to make sure we're getting to a
Let's
few.
do
So
the uh,
yeah.
Krista, for Krista, I want to make sure that because there have been a couple of questions around protecting IP. Krista, do you want to talk about like non-disclosures, protecting IPs, all of that?
Okay. So what we'll tell you right up front that the American Heart Association will not sign a non-disclosure, but we are bound by confidentiality. So there's a terms and conditions section of the website. And Olivia or Michelle, if you can put that link into the chat so everyone can see it, so that we're all bound by confidentiality throughout the the entire accelerator. And your IP, absolutely, you own it. Everything that's built and designed, even the new stuff that comes out of a design sprint, that is yours from start to finish. Okay, we don't touch it.
That's very helpful. Thank you. We have our kind of final questions here. So, beyond the scorecard, what's the single most common reason strong applicants may not advance?
Krista, do you want to take that one?
Sure. Okay, really strong applications. Let's frame that first. A strong application is okay, someone that can check all, or an organization that can check all the boxes, right, that we're looking for. However, we've had really strong applications not make it through to the end because, it really does, in order for you to be successful with this process, you really do need to adopt a beginner's mindset thinking, right? Because just know that whatever you bring into the accelerator is meant to be broken down. It's meant to be torn apart because we want to see what the opportunity is to go bigger and better, right? And for those organizations that are not comfortable with that, and it does come out in either the pre-accelerator or the accelerator process or the pre-accelerator, that level of discomfort and tension shows up earlier than you might anticipate, and it will impact whether your ability to move forward. And just know, you guys, even if as we're saying, we're here to tear down and rip apart and pull apart. It's all because we think you're freaking awesome, right? And you can be even better, right? Because at the end of the day, we want all of you guys to go back out in the market and kill it, right? But that means we have to all agree up front, okay, we need to look at everything apart that's a part of this process. And if you're unwilling to do that, then that's going to impact your ability to be accepted into this process. Because we've had some amazing applications come through, but that ego, oh my God, kills it every single time. You know, just keep an eye on that as you're applying.
And I think we have time for the final question. So, we talked a little bit about social determinants of health, and they are asking, is there a specific way or list of categories that we're looking at since they can be defined in many ways?
Yeah, so I believe in the application process, you have a drop down to put in which social determinants of health categories you'll be addressing. So that might help you narrow down which ones on the list. But in general, we are looking at barriers to leading a healthy lifestyle, such as um, transportation, access to care, food insecurity, education, employment or job security, housing, safe streets, air and water quality. So those are just a few. I know it's a lot of categories, but it's really where you live, work, and play, and how those uh, different points of access to living a healthy lifestyle have a barrier. So I do believe, though, that it's on the application drop down. So you'll be able to select one or add in the comments.
Thank you so much. And I saw one last question pop up. Do we have time to just go just one layer further for IP? This person is just asking for deep tech startups where early prototype work is done in collaboration with a partner. How does the program think about ownership at that point? And specifically, if it's kind of joint held, would that be a disqualifier? Or as long as a documented path to exclusive license is acceptable, would that be okay?
Krista, are you taking that one?
Oh, I think she had to drop.
Oh, okay. So what if you want to go deeper into that IP part, feel free to email us and we can definitely help clarify that, just because I want to make sure that it seems very, very specific. And so let's take that one offline and we're happy to, you know, get some clearer answers depending on your situation.
Absolutely. So, with that, for the email address, I dropped it, I think for a few folks, but if you have questions that are kind of that specific and related to the program, please email nextgen@heart.org. But before we wrap, just doing again another recap that applications close here at April 27th. You'll be notified the week of June 15th. The QR code here, which this deck will be shared out with you all, will take you to the website where you can just kind of learn more and also access the application. But again, we just thank you for your time and appreciate you joining this info session. And we hope you all have a great rest of your day.
And I wanted to just thank our funders really quickly for the ability to have the accelerator happen again this year and keep it going for future years. So specifically, we want to call out Wells Fargo and thank them for participating in the accelerator as a funder this year. And thank you so much to everyone who has joined. Please feel free to email us if you have any more questions and have a great day.